Good evening, everyone. We'll give it a few minutes to let people log on. Tonight's going to be an interesting topic, one I've not talked about before on social media. Welcome. Thanks for joining tonight. All right. Well, we got a few people joining in. It seems to be a popular topic I'm going to be chatting about tonight. So we'll get started. And for those that are coming on a little bit later, of course, this is being recorded. This will be saved on my Instagram TV channel. I'll also be up on my YouTube channel later as well. So normally I talk about biohacking topics or heart health. Tonight it's kind of related to both. So we're going to be talking about ED, not endothelial dysfunction, the ED that everybody's thinking about. But I actually don't usually like calling it ED. It's something that has a stigma to it. So let's talk about it as improving sexual performance for men. So as a preventive cardiologist, my job is to help people not have heart attacks and strokes. And one way I do that is to help people improve their endothelial function. The endothelium is inner lining of your blood vessels. You have approximately 60,000 miles of blood vessels. And one of the things that the endothelium does is it releases nitric oxide. Nitric oxide is a gas that dilates your blood vessels. It also acts as a Teflon type of compound, preventing stuff from sticking to the arteries in the first place. Why is nitric oxide important? Because that's essentially how Viagra and those type of class of medications actually work. The fancy terms are called phosphodiesterase inhibitors. They block an enzyme that normally degrades nitric oxide. Your body's making nitric oxide. This phosphodiesterase inhibitor chews it up. Nitric oxide goes low. Arteries cannot dilate. In order to create an erection and maintain it, you need nitric oxide. So anything that boosts nitric oxide is going to be healthy for the heart as well as for maintaining erections, but also anything that keeps nitric oxide longer in the playing field. So that's what the phosphodiesterase inhibitors do. So this is obviously a sensitive topic for many people, but it's something that I wanted to share with my audience because it's sometimes a chicken and egg situation where if a patient presents to the physician with cardiovascular disease and the doctor asks them, well, do you have any issues with sexual performance? And maybe they've never really thought about that or never really wanted to bring it up to a doctor, but they think about it like, yeah, I actually do. The stats show that approximately up to 10% of people under the age of 40 may have issues with erectile dysfunction, but it's actually an age-dependent type of phenomenon. And it's up to 50% of people over the age of 40 up to 70 years old may have erectile dysfunction or not optimal sexual performance. And again, it's mainly due to nitric oxide deficiency. So ED equals ED. But again, we're not going to try to use the ED term too much tonight. Optimizing health is what I'm generally talking about. So yes, since the blue pills were created in 1998, many men have been more open about talking about this. But again, it's a chicken and egg situation. If you show up to your doctor and you start asking for the little blue pill and it works for you, great. But you need to give it a good consideration that, what is going on with your heart? You have three arteries that sit on the outside of your heart. They need nitric oxide to dilate to provide nutrients to the heart tissue. If you're having issues with maintaining erections, you may be developing blockages in your heart artery. There are multiple causes of less than optimal erections, but the number one cause is a vasculogenic etiology, or that basically the plumbing system isn't providing enough blood flow to the tissue. I'm a cardiologist, remind you, I'm not a urologist, but the description is, to initiate an erection, you need blood flow coming in. You have arteries in your legs called the iliac arteries. They will ultimately branch off and give something called the pudendal artery. The pudendal artery will also provide blood flow to the penis. So you need blood flow coming in from an artery source. That blood flow ultimately gets trapped in the penis and the veins swell and they get compressed. And when the veins in the penis get compressed, the blood is present in the penis and causes an erection. If you're not able to put the flow into the penis to begin with, it's going to be very hard to maintain an erection. So, the same things that cause blockages in your heart arteries and carotid arteries are the same ones that are going to block it in your penis arteries. So, high blood pressure, smoking, oxidized cholesterol, diabetes, those are kind of the big ones off the top of my head. Obesity will have effect with it as well because there's a lot of inflammation compounds that get made with especially truncal obesity. But those are the main causes. But For the more mild and moderate cases of people, people who've had prostate surgery or spine surgeries and nerves have been injured, that's going to be a more complicated case. That's where you really have to work with a urologist specialist who might be able to talk about some other advanced options, which we're not going to chat about tonight. The other thing I always would recommend people do is look at their medications and supplements. From a cardiovascular standpoint, beta blockers are classically known to induce erectile dysfunction in men. They knock down adrenaline. They're useful for controlling heart rate for patients with heart rhythm issues. So they have atrial fibrillation, they have premature ventricular contractions. They get placed on beta blocker to cool down the arrhythmia. Or they're a patient who has had a prior heart attack, and you're decreasing the oxygen demands to the heart, so that the person doesn't experience angina or chest pain when they're exercising. And then another class, sometimes the beta blockers are used is for hypertension or high blood pressure. So if people are on blood pressure medications and having less than optimal erections, talk to your doctor, talk to your pharmacist, and see if one of your prescription medications is potentially contributing to your initial concerns. And then the other thing is, more of a psychological etiology, contributing to erectile issues. So if you have anxiety, performance anxiety, you have depression, especially if you have PTSD or if you had, trauma in the past, essentially your brain is not going to be sending the right signals down below to make things happen. The other big thing that I kind of haven't chatted about too much is testosterone. Can low testosterone contribute to erectile dysfunction? The data in my limited knowledge and reading is that it's sort of mixed. If you're extremely hypogonadism, yes, you'll likely have issues with erectile dysfunction because testosterone can act as a vasodilator. But when people replace testosterone to normal levels, they may have improvement in erections. But if that's their only complaint is erectile dysfunction and they have, quote, low testosterone, replacing testosterone is not likely to be the thing that absolutely gets them back to optimal performance. Again, it's mostly a vasculogenic cause, or blood flow into the system isn't working perfectly. So, we've started off talking about what nitric oxide is. I've done previous talks on nitric oxide boosting. Sunlight on your skin, UVA particularly, causes those arteries to dilate and liberates nitric oxide. Things that can also boost testosterone production are things like red light devices. There's some data, maybe 3 to 400% increase in testosterone using red light therapy on the gonads. You got to sleep well. If you don't sleep well, you have sleep apnea. You're not going to be it should not be too surprising if you have low testosterone levels. So fix your sleep issues to see if your testosterone improves. Add resistance training that can help improve testosterone production. Other things that can help with nitric oxide production, this is, exercise will help with it as you have blood flow rushing to your muscles. There's shear stress, and nitric oxide is going to get released. From foodstuffs, it's mostly the green leafy vegetables and beets. The nitrates in those compounds get converted in your saliva, ultimately to nitric oxide. But you need a functioning enzymatic system in your stomach. So you don't want to be on acid blocking medicines for a long period of time because that messes that system up. And you don't want to be using antiseptic mouthwash because you're going to kill the good oral bacteria in your mouth that help make that conversion of the green leafy vegetables and beets into nitric oxide. I earlier talked about the little blue pills, most people call it Viagra, the Cialis, Stendra, and Levitra. They keep the phosphodiesterase inhibitor enzyme inactivated, so nitric oxide can hang around longer. But those medications are one-off uses. They're not getting to the root cause of why those people aren't making nitric oxide in the first place, or not optimal levels of nitric oxide. So that's what I do in my cardiovascular world, is trying to figure out what the root cause is. So advanced blood work can figure that out often, and then work on improving lifestyle supplements and potentially medications, improve nitric oxide production. So get the flow improving, and potentially the medications, the blue pills may not be necessary, or they'll work better for people who the pills don't typically work. Because in some reports, the Viagra type medications may not work in up to 40-50% of people. And the people that they do work in, some people experience headaches, lightheadedness, vision changes. This is the reason why I always tell you, don't take nitrates when you're taking Viagra type medications, because it's going to essentially double up on your nitric oxide production, or I should say nitric oxide levels, which can lead to hypertension or low blood pressure, can make you dizzy, pass out, potentially even have a stroke. So definitely don't want to be taking nitroglycerin and medications like Viagra. But I said it earlier, if you're somebody who, quote, thinks they always need a medication to develop an erection, and you don't know that you don't have heart disease yet, go make sure you get your heart checked out, because again, if you have blockages in the arteries going to your penis, there's not unlikely chance that you have blockages going to your heart artery as well. And we've done previous talks about, tests that look at that non-invasively. A CT coronary calcium score test is kind of the go-to quick non-invasive test, usually about $100. Will tell you, do you have hard plaque building up in your arteries? If you got hard plaque in your coronary arteries, you got 6,000 miles of blood vessels, that plaque can be building up in other places as well. So those are kind of the intro to the topic tonight, and some things that can help with nitric oxide production and also keeping nitric oxide levels high with the pharmaceutical agents. But tonight I wanted to talk about a little bit about a new piece of technology. So I'll show the box and we'll go through the demo in just a little bit. Not the full demo, but there's a device called the Phoenix Pro. It's fairly new to the market. It's essentially a home use version of the Gainswave piece of technology. So there's something called lithotripsy that they've been using to help with breaking up plaque, breaking up kidney stones and also breaking up gallstones. So, it's called shockwave therapy, but it does not involve electricity. It's essentially using sound waves to break up things. So at very high frequencies, it can break up these stones. Well, they basically dialed down the frequency, and they were actually treating heart patients, not in the US, and also a lot of animal models, that they're actually getting decreased angina, and we're having neorevascularization, so basically growing new blood vessels to these pigs by stimulating the chest with these shock waves or sound waves. It's thought that helps stimulate endothelial function with these different shear stresses, so it's somewhat like exercising without exercising. So somebody got the idea that, hey, why don't we try this at a lower intensity on the penis and see if it can help with erectile issues. So this device, the Phoenix Pro, is the first essentially home use device that has physicians who are monitoring the protocols. There are other devices on the market that it's kind of not to say gray market, but it's sort of buyer beware. You don't know exactly the quality of the device you're getting, and you get very little, if any, instruction on how to use the device or what the protocols or the optimal protocols should be. So this technology helps with, again, helping with neorevascularization. So if it's a flow problem and you're basically growing new blood vessels, then you're actually getting to the root cause of the problem. So you're improving nitric oxide, bringing new blood flow to the area. You can also stimulate nerve regrowth in certain diabetics and such. Nerve damage is not uncommon. Sensitivity would go down, so if you can improve nerve function as well, that's kind of a double bonus. So I'll show you what the device looks like. And yes, I definitely, had my high school, all-boys school laughing fit when I first saw the device, but now I'm acting very professional. But the device looks almost like a rocket. It is external use only. Basically, you would hold it like a pencil, sound waves come out of the tip, and you can imagine how you use it on the outside. You stroke through 10 times, up and down, up and down, up and down, and 5 different kind of clock faces. And you do that, it takes about 10 to 20 minutes. For most people, 2 sessions a week for 6 weeks, and they should notice some improvement. How much? The data is somewhat mixed. Most people will get some response, or they'll at least get a response where the blue pills, Viagra, didn't work for them, when all those medications will work for them. So that's a win for many people. But some people actually are able to even stop having to take Viagra-type medications. Now, how long does it last? Again, not fully studied in the literature that I could review, but most time people are getting at least a 50% staying power after the results, after they finish the treatment, and then you can kind of spot weld or spot use it to kind of maintain the gains that you had gotten. So that's the Gainswave technology, now shrunken down into the Phoenix Pro, which is a home unit. If you're interested in learning more about this, this is being offered at Apollo Cardiology in my office in St. Louis, Missouri. For those that are in St. Louis and go to my office, I'll have a model that people, if they wanted to discuss further, happy to do so. If you're watching this online and don't live in the St. Louis area, also happy to do telemedicine or remote visits and consults regarding this piece of technology. If you're interested in that, just send me a message. Just put Phoenix in the header or come to my website. It's apollocardiology.com. Very soon going to be relaunching drtwyman.com. So don't go to drtwyman.com because it's not going to forward just yet, but apollocardiology.com is my main website. And if you're interested in learning more, send me a direct message. So I'll thank you guys for your attention tonight, and I'll open it up to questions. And I can totally understand that, in my typical biohacking talks or cardiovascular talks, people are more willing to share their lipids and everything. So don't switch to share real personal details in the comments here. So if there's not, questions coming in tonight, that's totally fine. Again, this video is going to be available for replay. If you do have questions, again, send me a direct message, call my office, visit my website, apollocardiology.com. So you're very welcome. Thank you for the comment. So. All right, guys, that's what I have for you this week. Next week, I'm going to be shooting on location. I'm going to be launching essentially a 21-day circadian rhythm reset program pretty soon. I'll do some stories on this Instagram next week, kind of show what I would do for an optimal circadian day, and then I'll teach you guys how to do the same. So have a great evening, and we'll see you guys next week.